There is a conversation I have had more times than I can count. It happens in exam rooms, in hospital hallways, in follow-up appointments that should have been first appointments. A patient sits across from me and says some version of the same sentence. I noticed it months ago. I thought it was nothing. I kept waiting for it to go away. And then I kept waiting a little longer. And in that long pause after the sentence, I hear something that never stops being difficult to sit with. The weight of time that cannot be taken back. Here is what I want you to understand before we go any single step further. The difference between cancer caught early and cancer caught late is almost never the cancer itself. It is almost always the window of time between when the body first sent a signal and when someone finally decided to take that signal seriously. That window, those weeks and months of waiting and explaining away and adjusting to something that felt just a little bit off, is where outcomes are decided. Long before any scan, long before any diagnosis, long before any treatment plan is ever written. And the reason that window closes on so many people is not because they are irresponsible. It is because the early signals that cancer most commonly sends are so mild, so easy to explain away, so perfectly designed to be absorbed into the background noise of everyday aging, that most people do not recognize them as signals at all. They recognize them as inconveniences, as minor complaints, as things they will mention at their next appointment, if they remember. And sometimes they do not remember, because by the time the appointment comes, they have already normalized what their body has been trying to tell them for months. I'm Dr. Hayes Anderson, and after 22 years in senior health, I've seen firsthand what happens when these early signals are missed, and what changes when they are finally taken seriously in time. Today, I am going to walk you through 8 early cancer warning signs that seniors consistently underestimate, delay reporting, or explain away as normal aging. I have organized them deliberately, from the signals that are most commonly dismissed as harmless, building toward the 2 that demand the most immediate attention. And I need to say something now about number 6 before we get there, because that is the one that most often generates a delay measured not in weeks, but in years, and that delay changes everything. Let me tell you something the medical system does not communicate nearly clearly enough. Cancer screening saves lives, and it does so specifically because most cancers, when detected early, are highly treatable. The survival rate for colorectal cancer caught at its earliest stage is over 90%. For breast cancer detected early, it exceeds 95%. For lung cancer caught at stage 1, survival rates have risen dramatically with modern treatment. But those numbers depend entirely on one thing, that the cancer is actually found at that early stage. The problem is that many early-stage cancers produce symptoms that are not dramatic enough to feel like emergencies. They do not send you to an emergency room. They do not stop you in your tracks. They produce symptoms that feel like something else, an age-related change, a digestive complaint, a mild infection, a string of bad nights. And because those symptoms feel explainable, they get explained away. In a 15-minute primary care appointment where the doctor is also managing blood pressure medications, reviewing lab work, and addressing 3 other concerns, a symptom the patient describes as nothing serious, just something I've been noticing, rarely receives the investigation it deserves. This is not anyone's failure of character. It is a structural gap between how cancer announces itself and how the medical system is built to respond to announcements. What closes that gap is you, walking into your next appointment with a specific symptom written down, a clear timeline of when it started, and the knowledge that what you are about to describe deserves a real answer. That is what this video is designed to give you. 1. Unintentional weight loss. When someone loses weight without trying, without changing their diet, without increasing their activity, the medical system has a term for it. We call it unexplained weight loss, and we define it clinically as losing more than 5% of your body weight over a period of 6 to 12 months without any deliberate effort. For a 160-pound person, that is 8 pounds. For a 180-pound person, that is 9 pounds. Here is why this matters. The body does not willingly shed weight without a reason. Weight loss requires either a reduction in calories consumed, an increase in calories burned, or a metabolic change driving the body to process its own reserves. When none of the first two are present, the third deserves investigation. Cancers can cause weight loss through several pathways: by altering metabolism directly, by triggering inflammatory signals that suppress appetite, or by physically interfering with digestion and nutrient absorption, depending on their location. Let me tell you about Raymond, 68 years old, a retired electrician from Ohio. Raymond came to my office for a routine physical and mentioned almost in passing that he had lost about 12 pounds over the previous 4 months. He was not alarmed. In fact, he was quietly pleased. He had been trying to lose weight for years, and he assumed his body had finally cooperated. He had not changed his eating habits, had not started exercising more, but he attributed it to getting older, to metabolism shifting, to something benign. A comprehensive blood panel and follow-up imaging revealed early-stage lymphoma, cancer of the lymphatic system. Raymond began treatment within 6 weeks of that appointment. He is doing well. But that 12 pounds, that number he was ready to accept as good news, was his body's first clear communication that something was wrong. The question that changed everything was not dramatic. It was simply, "Did you try to lose this weight?" The answer was no. And no changed everything. 2. Persistent fatigue that does not respond to rest. I want to draw a careful distinction here because we explored fatigue in depth in our last video, and I do not want to create unnecessary alarm. Fatigue has many causes: medication side effects, thyroid dysfunction, anemia, sleep apnea, blood sugar dysregulation, and most of those causes are not cancer. What I want you to understand is the specific texture of cancer-related fatigue, because it is different from other kinds of tiredness in ways that matter. Cancer-related fatigue tends to be profound, consistent, and entirely unresponsive to rest. It is not the tiredness of a poor night's sleep. It does not lift after a good weekend. It is present at a similar level every day, and it often arrives alongside other symptoms on this list: weight loss, changes in appetite, or something that simply feels different from baseline in a way the person struggles to articulate. When fatigue has been present for more than 4 to 6 weeks, has no identifiable cause, and is accompanied by any other symptom on this list, it moves from a routine complaint to a flag that deserves laboratory investigation. A comprehensive metabolic panel, inflammatory markers, and a complete blood count. That combination can reveal signals that point a clinician in the right direction. The key question to ask yourself is not simply, "Am I tired?" It is, has this tiredness persisted for more than a month? Does it feel different from fatigue I have experienced before? And is it accompanied by anything else I have been noticing but not saying out loud? If the answer to all three is yes, that is a conversation for your doctor's appointment, written down at the top of the list. 3. A cough that stays, or a voice that changes. A cough that persists for more than 3 weeks after any associated cold or respiratory infection has resolved, or a cough that arrives without a clear respiratory cause, deserves attention. Most persistent coughs have benign explanations: postnasal drip, acid reflux, a medication side effect from certain blood pressure drugs. But a persistent cough is also one of the most common early symptoms of lung cancer, and lung cancer remains the leading cause of cancer death in both men and women in the United States. The cough often produces no blood. It often produces nothing remarkable at all. It simply stays, week after week, when it has no clear reason to stay. A change in voice, hoarseness that has lasted more than 2 or 3 weeks without an obvious cause, belongs in this same category. The larynx sits in a region of the throat where early tumors can produce hoarseness before they produce any other symptom. A voice that has changed in quality and stayed changed for more than 3 weeks in the absence of a recent respiratory illness or obvious strain is worth a direct evaluation. Beverly, 71 years old, a retired librarian from Pennsylvania, had a cough for 14 weeks before she mentioned it to anyone. She attributed it to allergies, then to the dry air in winter, then to a mild cold she was sure she was fighting off. She had no pain, no difficulty breathing, no blood. The cough was simply there every morning, productive of clear mucus, easy to explain away, and easy to almost forget about. When she finally mentioned it at a routine appointment, an X-ray led to a CT scan that revealed a small nodule in her right lung. A biopsy confirmed early-stage lung cancer. Beverly underwent a minimally invasive surgical procedure. She is fully recovered. 14 weeks between first symptom and first mention. And that 14 weeks, in her case, was still early enough. For many people, it is not. 4. Changes in bowel or bladder habits. The digestive tract is remarkably consistent across a lifetime. When it changes in a meaningful and lasting way, when bowel habits that have been stable for decades suddenly shift, and that shift persists for more than a few weeks, the body is communicating something worth hearing. A change in frequency, a change in consistency, a persistent sensation of incomplete emptying after a bowel movement, or alternating episodes of constipation and loose stools that have appeared without a clear dietary explanation. These are the specific changes that warrant direct conversation with a physician. Colorectal cancer is among the most preventable and treatable cancers when caught early, and changes in bowel habits are among its most consistent early signals. Blood in the stool, whether visible as red or presenting as a darkening of the stool's color, is a flag that belongs in an emergency conversation, not a 2-month waiting game. But the subtler changes, the shift in pattern, the persistent change in frequency, the new sensation of incompleteness, those are the ones people most commonly attribute to diet, to stress, to something they ate, to simply getting older. Carol, 74 years old, a grandmother of 7 from Georgia, noticed a change in her bowel habits in early spring that she attributed to a change in diet after the holidays. When it persisted into summer, a persistent pattern of narrow stools, a sensation she described as never quite feeling finished, and an occasional dull ache low in her abdomen, she mentioned it to her daughter. Her daughter insisted she call her doctor. A colonoscopy revealed a polyp and an adjacent early-stage tumor in her sigmoid colon. Carol had surgery and made a full recovery. She told me later that she had been on the edge of dismissing it for another month or 2 because she felt otherwise fine. That extra month or 2 in her case would have meant the difference between stage 1 and stage 2. It would not have changed her outcome, but the margin was closing. It is always closing. Stay with me, because the next warning sign is one that produces more delayed conversations than almost any other on this list. And understanding why tells you exactly what to do differently. 5. Unusual bleeding or discharge. Blood appearing where it has no reason to appear, or discharge from a part of the body that does not normally produce it, is one of the most direct early signals the body is capable of sending. It is also one of the most consistently delayed in reporting, for reasons that are entirely understandable and entirely worth interrupting. Blood in the urine, even once, even a small amount, even if it resolves and never returns, warrants same-week evaluation. Blood in the urine can indicate bladder cancer, kidney cancer, or prostate cancer, all of which are far more treatable at early stages. Many people see blood in the urine once, watch carefully for the next several days, and when it does not reappear, they conclude the episode was a fluke and move on. That reasoning is understandable, and that reasoning has contributed to delayed diagnoses more times than I can account for. Postmenopausal bleeding, any vaginal bleeding in a woman who has been through menopause, is in the same category of symptoms that require prompt evaluation, as it is a known early signal of uterine cancer. Bleeding from the rectum that does not have a clearly confirmed benign explanation, a formal evaluation confirming hemorrhoids, not just an assumption of hemorrhoids, belongs in the same category. Unusual nipple discharge that appears without pressure in a person who is not breastfeeding. Unexplained bleeding from any site that the body has not historically produced bleeding. These are not dramatic symptoms. They are quiet ones, and quiet does not mean safe. 6. A sore that does not heal, or a skin change that will not resolve. This is the one I mentioned at the beginning of this video. This is the warning sign that generates delays measured not in weeks, but in months and years. And the reason it does is not difficult to understand. A sore that is slow to heal, or a skin lesion that changes gradually over time, does not feel urgent. It does not hurt in the way we expect a serious medical problem to hurt. It sits there, visible but non-threatening, easy to cover with clothing, easy to monitor informally, and convince ourselves is either staying the same or slowly improving. Skin cancer is the most commonly diagnosed cancer in the United States. Melanoma, the most dangerous form, is highly curable when caught in its earliest stages, and far more dangerous when it is not. The signs to know are changes in a mole or pigmented spot that grow, change in color, develop irregular borders, become asymmetric, or begin to bleed. A sore anywhere on the skin, mouth, or tongue that does not heal within 2 to 3 weeks is in the same category. A white or red patch inside the mouth that persists is a signal that oral cancer can produce before it causes any pain at all. The practical instruction here is simple, but requires honest self-examination. Look at your skin regularly. If you notice something new, or notice something that has been there a while and seems to be changing, do not monitor it informally for another 3 months. Make an appointment. A dermatologist can evaluate a suspicious lesion in minutes. The cost of being wrong about something benign is a brief appointment. The cost of waiting on something that was not benign is a conversation none of us want to have. 7. A lump, thickening, or swelling anywhere. A new lump anywhere in the body, in the breast, in the neck, in the armpit, in the groin, along the jaw, that has been present for more than 2 weeks and has no obvious explanation, deserves a clinical evaluation. Most lumps are benign. Cysts, lipomas, swollen lymph nodes responding to minor infections, benign fibrous tissue. Most lumps that people find are not cancer. But the only way to move from uncertainty to certainty is evaluation. And certainty, even certainty about something benign, is not something you can achieve through observation alone. Lymph nodes that remain enlarged for more than 3 to 4 weeks, particularly in the neck, collarbone, armpit, or groin, are one of the body's most consistent early signals of lymphoma and certain leukemias. They are typically painless. They feel firm. They do not resolve the way lymph nodes swollen from a common cold resolve, within a week or two. They simply stay. And because they are painless, because they do not interfere with daily function, because they can be so easily attributed to something minor, they are often present for months before a patient mentions them. I am not asking you to examine your body in fear. I am asking you to examine it in the same spirit of informed attention you would bring to checking your blood pressure or tracking your morning fasting blood sugar. The body communicates through physical changes. Listening to those changes with knowledge is one of the most powerful things you can do for your long-term health. 8. Persistent pain with no clear structural cause. Pain that has been present for more than 4 weeks, that does not have a clearly identified structural explanation. No documented injury, no arthritis confirmed in imaging, no obvious musculoskeletal source, and that has not responded meaningfully to standard pain management approaches, belongs in a different diagnostic conversation than most seniors are ever invited into. Bone pain, particularly pain in the back, hips, or long bones, that is worse at night, that wakes someone from sleep, and that has been gradually worsening over weeks, can be an early signal of primary bone cancer or of cancer that has spread to the bone from another site. Abdominal pain or pelvic pain that is new, persistent, and not clearly explained by a diagnosed digestive condition warrants imaging. Headaches that are new in character, different from any headaches a person has experienced previously, and that are persistent or progressively worsening over weeks, deserve evaluation. The word I want you to hold on to is persistent. Any pain that stays, that does not follow the expected pattern of improvement with rest and time, that gets slightly worse rather than slightly better over the course of weeks, that pain is asking for a direct answer, not management, an answer. And getting that answer is what a formal evaluation is for. I want to sit with you here for a moment before we close. Because I understand the weight this kind of information carries, and I want to be precise about my intention in sharing it with you. I am not trying to make you afraid of your own body. I am trying to give you a different relationship with the signals your body sends. Fear makes people avoid. Knowledge makes people act. And acting, picking up the phone, writing a symptom on a piece of paper, walking into an appointment and saying, "This has been going on for 6 weeks, and I want to understand what it is." That act, taken early, is what separates the patients who sit across from me with good news from the patients who sit across from me and say, "I noticed it months ago and thought it was nothing." Cancer is not one disease. It is a category of diseases with enormous variation in behavior, treatment, and outcome. And across almost every type, the single greatest predictor of a good outcome is the stage at which it is found. Early detection is not a medical cliché. It is the mechanism by which lives are saved. And it begins not with a scan or a blood test, but with a person deciding that what their body has been communicating deserves a real response. Here is what I want you to do this week, specifically, not eventually. First, go through this list and write down any symptom that has been present in your body for more than 3 weeks that you have not yet formally reported to a physician. Be honest, not the dramatic symptoms, the quiet ones, the ones you have been explaining away. Second, make an appointment this week, not at your next scheduled visit if that is 2 months away, this week. Call your doctor's office and say you have a symptom you would like evaluated. You do not need to use the word cancer. You need to say, "I have had this for this long, and I would like it looked at." That is enough. Third, if you are over 45 and have not had a colorectal cancer screening, make that appointment as well. If you are a woman and are overdue for a mammogram or a pelvic exam, make that appointment. If you are a man over 50 and have never had a PSA discussion with your physician, put that on your list. Screening is the system working the way it is supposed to work, and it only works if you participate in it. Fourth, share this video. Not as a gesture toward a channel, as an act of care towards someone in your life who needs this information and has not yet heard it. A spouse, a sibling, a close friend who has been mentioning something minor for months and not doing anything about it. This information belongs to them too. Tell me in the comments, which of these 8 warning signs felt most familiar to you? Which one made you stop and think, I have been noticing that, and I have not done anything about it yet? Your answer matters. It tells me where to go deeper, and it may help someone reading the comments find the courage to make a call they have been putting off. I'm Dr. Hayes Anderson. Take care of yourselves, and please, take the signals seriously. I will see you in the next video, where we go deep into the one hidden condition that is silently driving inflammation, pain, and accelerated cellular aging in the majority of seniors, often for years before any formal diagnosis is ever made. Chronic inflammation. That is what comes next. Do not miss it.